Thanks. Well, former President Bill Clinton, as you know, is recovering at his New York home after a surgical procedure yesterday in which doctors inserted 2 stents into one of his coronary arteries.
Sources say he's doing okay and he's anxious to get back to work. Dr. Michael Chang, medical director at Cardiology at Mercy General, joins us now to kind of break this all down. Will he actually be able to return to work pretty soon?
Yeah, he should be able to return to work, I think, in the next couple days.
What's interesting about this procedure is that President Clinton had a bypass surgery a couple of years ago, and it was one of the bypasses that became clogged this time,
right,
which is not that unusual.
That's
really.
right. Right. He had bypass surgery, I think, in 2004. He had 4 grafts put in.
In fact, let's show you have this heart model here to kind of show what a bypass looks like and kind of explain like where the blockage, for instance, may have been.
Sure. This is a heart model, and it actually has a picture, a model of 3 grafts right here. And what bypass grafts is they are usually veins, sometimes arteries, and the surgeons connect them from the aorta and into the arteries of the heart, bypassing the blockages and allowing blood flow to go through from the aorta to the graft into the artery down here.
But then one of those became blocked.
Right.
And that's what he was feeling, because he thought he was having a heart attack when he went in, which he wasn't, we figure what we've heard, but it was a warning sign that there was that blockage.
That's right, yeah.
So then now they put a stent in, and you actually have a blown-up version of what a stent actually looks like.
Right, so from what I understand, one of his grafts was 100% blocked, and they were fortunately able to open up the graft and put 2 stents in to keep it open. And I have a model here of a stent.
So that's what it looks like when it's open. But so show this wire, this thin little wire. This is how it all begins, right?
So this is an actual catheter with a stent on a balloon. And I don't know if you can see that here.
So that feeds into the artery.
Right.
And it's got that little wiry thing is all compacted down inside there.
Right. And this artery, the catheter goes in through the graft up here and is deployed inside the graft to keep the stent open.
How long does it usually take to get the stent in there?
It doesn't take very long. I think this procedure, if it was uncomplicated, was probably done within 1 hour.
So you said I could blow this up, right?
Yeah, you want, so I brought this in. Let me show
So what happens, so you feed it into the artery, and it's all compacted down there, and then you deploy it like you would deploy a balloon, so something poofs up that stent. The balloon poofs that up. Right.
Okay. Right. When we inflate
so here we are, we're in the artery now.
So inflate the balloon, deploy the stent, we'll deflate the balloon, the stent remains behind.
The stent remains, and you take the balloon out.
So crank this up, just turn this thing up.
This thing here? It's like running the old teleprompter.
Yeah.
Okay.
Go up to like 12 here.
Oh, so I got to really go.
Yeah.
Turn it up to 11.
Am I turning this the right way, like that?
Let me see here. Hold on.
I'm not a doctor. I'm just playing one on TV.
I'm glad we found out this thing's busted now.
No, it's probably operator error. I am not a cardiologist, although I know I claim to be one. I'm constantly talking about heart health all the time.
There you go.
Okay, is it going? Starting to go?
Yeah, just crank this up.
So just keep going?
Just keep cranking, yeah.
Keep cranking it up there.
Yeah, there you go.
Oh, okay.
Wow.
Okay, now it's all...
It looks like such old technology, but
now it's not turning. Am I turning this part?
Yeah, right.
Yeah, that's as far as it'll go.
As far as it goes? Okay.
Yeah.
Well, I guess it's not working, but anyway.
Oh, come on.
Oh, you broke it.
I did. I'm sorry.
Oh!
That's right.
Nice. Well, that's right. We have insurance for that. Are stents, are they temporary, or is it like a temporary fix?
Well, unfortunately, coronary artery disease is a progressive disease, and that's like diabetes or it's like cancer. And there are certain risk factors to prevent coronary disease from happening, such as smoking, high blood pressure, diabetes, and high cholesterol. And even if you have an intervention like this, either stents or bypass surgery, the disease continues to progress. So it's even equally important before and after an intervention to work in your risk factors.
And we heard that the president maintained a healthy lifestyle, done pretty well with that, but this happened anyway. And also a good point that you should listen to your body. If you're feeling a pain, you need to have it checked out. I know women are notorious for not having that done, but you should delve and talk to your doctor about it.
Right.
Well, I'm sorry I didn't get to blow up this stent this morning.
That's right. Just put it on our tab.
That's pretty cool. Yeah, exactly. Just add it to the list. Dr. Chang, thank you very much. We appreciate you coming in. Dr. Michael Chang, the medical director of cardiology at Mercy General.
Thanks, doctor. Have a good weekend.
Thank you.